What are the options then for people that you cannot save their teeth, you have to extract all their teeth, or the person that's currently wearing a denture? What are the options for dental implants in those cases?
With those patients, there's a couple of options. One is they can put a couple implants in, two, and have their denture snap into the implants. Okay. So at least their denture stays in place, doesn't need adhesive. They can chew a lot better. It's not like permanent teeth, but it's a lot better than a denture.
All right.
And if they want it to be a little bit more stable, they can put an extra couple implants in and make it snap into more implants. So again, they're still wearing a denture, but at least a denture that doesn't fall out of their mouth and need adhesive. And then finally, the best that we can offer them is to put several implants in to hold in permanent teeth. And that's the same as having your
And
own
you
teeth.
say as little as 4 implants, you give them a full arch of teeth that don't come out.
That's it. That's all they need is 4 implants.
So it's like having their regular teeth back.
It's like having their regular teeth back, yes. No plastic, no removable things, nothing that they have to put in the glass. They brush them like normal. They take care of them like normal.
You did this for your parents as well?
Yes, I did.
Okay, good. Now what about the upper? But the upper's good, right? Because the roof of the mouth, it'll like suction with the denture.
Patients that are denture wearers don't complain that much about their upper dentures because most upper patients that wear upper dentures, they have that palate on there and it kind of sticks in place, and it's a nice big palate to stick a lot of greasy glue on it and stick it right up in there. But what they don't realize is that that's what they're tasting when they eat. The Polident or the Effigram or whatever dental adhesive they're using. While if we put in a couple of implants, we could put in a permanent set of teeth with no palate. So they get their full range of taste back again.
And this is done in one day?
That's done in one day. No,
and now you do it all right there, right? You have the concept where you do the surgery there, you have your own lab, you make the teeth there, it's all done right there.
It's all done right there. We make it so easy and efficient, as easy and efficient as possible. That's kind of what I strove to set up in those practices.
Now you did this on one of your golf buddies.
Yes,
I did. It's a great story.
Yeah. We were playing golf, and he's a really good golfer. And I didn't know that he wore dentures. I just know he didn't smile very much, but no, he was a good enough guy. He hits a ball about 300 yards, and we're all watching it because the foursome that I'm with. And as he swung, his denture flew out of his mouth.
Wow.
So while we're all looking at his drive and seeing how well he hit it, he's looking for his teeth in the grass. So, you know, they were all commenting and laughing, but it really...
It's not funny to him.
You know what? He laughed, and he's that kind of person, but it's not. It's an embarrassment. And when I was sitting with him in the golf cart, I said to him, "Why are you wearing a denture? How is that? Do you know what I do for a living?" And he said, "Jeff, buddy, I was told I don't have bone. I really don't want to be like this. It's one of the most embarrassing things for me. It's awful." I said, "Come to the office." And in his particular case, he was one of those 1 in 100 patients that didn't have enough bone. So we grew bone back for him. It took an extra 3 months, and now he wears permanent teeth.
Is that right?
Yeah.
And this is a guy that would have just, what does he say? I mean, like when it's all done, does he say?
He said, "I am a different person. I have," he was a confident guy anyway, but he was reserved. Now he's a completely different human being. He's completely changed. He hangs out with us after he plays golf and eats with us. Before he didn't. They
make excuses.
They make excuses. He's going to go here. He's going to go there. He's eating a hot dog somewhere. You don't know where he is. But the reality is, his teeth are loose, and he's embarrassed about it. And he's a successful guy. How he lost his teeth doesn't make a difference, but he's a successful guy, and he belongs to a golf club, so certainly he has the money to take care of it. And
so a lot of people like that, they've adapted. They've got their denture, and they think that's all there is.
Yeah, and they think that's it. And they're not given advice by really trained people.